In Fox 5 Health News tonight, one of the most common knee surgeries is being called a waste of time and money. Researchers are now saying that instead you might be better off with rest, physical therapy, and over-the-counter pain medications. Okay,
joining us right now is Dr. Keri Peterson from Lenox Hill Hospital. Thank you very much for being here,
Great to be
Keri.
here.
Yeah, nice to have you here today, and you look great.
Thank
very
you.
Festive.
Thank you, Ernie.
Very happy. Everybody looks great.
Hi, Sharon.
Hello, good to see you.
Yeah, nice to see each other, but we're talking about something that could be painful and difficult for a lot of people. This is a torn meniscus, and this kind of surgery, from what we understand, affects a lot of baby boomers. Why is this surgery ineffective, as we just said?
Well, what the surgery is, it corrects a meniscal tear. The meniscus is the little cushion in the knee that gives it some bounce. 700,000 procedures are done every year. It costs our healthcare system $4 billion. And the question is it really necessary? Does it improve outcome? A study looked at just that in patients who have wear and tear meniscal injuries who do not have arthritis. They split the group in half. Half of them got the surgery, half got a sham surgery where it simulated the procedure. And they looked at them a year later and found out both groups did equally well. No difference between them. So having the repair did not offer an additional benefit to these people.
But there is a flaw with this sham surgery, you said?
Well, there is, because the patient doesn't know what they're getting, so they have to simulate it. So they inject a fluid in there, they put the camera in, and the critics are saying that that fluid can flush out some of the debris in the knee anyway, and that does offer some of the clinical improvement that's found. So they're questioning the results of this study as to whether people still may need the surgery.
Who would be the candidates for that kind of surgery?
Well, the authors are now deducting that people that are younger and people who have traumatic meniscal tears are the best candidates, and that people who just have good old wear and tear without arthritis don't necessarily need it.
All right, shall we move on? We have other things to talk about today. Yeah, other headlines in health news. Want to put a little smile on your face?
Yes, I do.
Want to feel good?
I have one there.
You always have a nice smile on your face. Well, these people especially are having a good time because they're hitting the slopes. Researchers say that even just casual skiing and snowboarding, by the way, can boost our overall sense of happiness.
As long as you're not falling down, right?
Well, that's a good point, Sharon, as long as you're not falling. I'm a skier myself. I agree with the findings. These researchers interviewed people that ski and snowboard and found they have a better sense of well-being this time of year.
What is it?
Well, the winter time, I think, you live in the Northeast, it gets dark when you walk out the door from work, you're inside all day, and skiing offers an opportunity to be in the fresh air, to have a change of environment in the mountains. You're with your friends.
Yeah, social.
You get your blitz of social.
A little cardio,
right? Exactly. You get the endorphins going. Plus, if you ski, you know it takes a little mental focus not to fall. That mental focus takes your mind off what's going on in your life.
And the snowboarding is good as well,
Just as well. Skiers set a little bit better outcome than snowboarders.
How about ice skating?
Really? Interesting.
Ice skating. I like the ice skating.
Although
well,
not
you're
as
not
beautiful.
always outside when you're ice skating.
You're not in the
Sometimes you're
mountains.
outside.
That's true. You can be at an indoor rink, right?
Yeah, it doesn't necessarily get you outside. I don't ice skate.
And if you wait in a long line at Rockefeller Center or something,
then that's just a hassle.
But the atmosphere at Rock Center is fantastic, though. Isn't it great to be down there and to get the hot chocolate?
That's true. When you're watching the ice skaters.
I know. So that's the key. Then we can be a little happier about skiing. Are you a skier?
I'm a skier. Yes. Yes.
So you know exactly what we're talking about. You mentioned that.
Yes,
I'm a snow plower. You know what that is?
Is that
not a very good
the pizza pie that kids do?
Similar to my driving, but we'll talk about that later.
Nick's a good skier, though.